Megaloblastic anemias. Defective DNA synthesis causes abnormal nuclear maturation. RNA synthesis is normal, so the cytoplasm is not affected. The nucleus matures slower than the cytoplasm, a condition known as asynchronism. Megaloblastic maturation is seen. Caused by either a vitamin B12 or folic acid deficiency. Laboratory findings include pancytopenia, macrocytic and normochromic anemia with oval macrocytes and teardrops, and hypersegmented neutrophils. Inclusions include Howell-Jolly bodies, nucleated red blood cells, basophilic stippling, Pappenheimer bodies, and Cabot rings. Elevated levels of LD, bilirubin, and iron are due to the destruction of fragile, megaloblastic cells in the blood and bone marrow. Vitamin B12 deficiency, also known as cobalamin deficiency, is a condition that can have significant health impacts. Intrinsic factor, which is secreted by parietal cells, is essential for binding vitamin B12 and allowing its absorption into the intestine. Pernicious anemia is one of the primary causes of vitamin B12 deficiency. This condition can arise from a deficiency of intrinsic factor, the presence of antibodies to intrinsic factor, or antibodies to parietal cells. It's more prevalent in older adults of English, Irish, and Scandinavian descent and is characterized by achlorhydria and atrophy of gastric parietal cells. Other causes of vitamin B12 deficiency include malabsorption syndromes, the Diphyllobothrium latum tapeworm, total gastrectomy, intestinal blind loops, and a strict vegetarian diet. Clinically, patients may exhibit symptoms such as jaundice, weakness, a sore tongue or glossitis, gastrointestinal disorders, numbness, and other central nervous system problems. It's important to note that vitamin B12 deficiency takes 3 to 6 years to develop due to the high stores of vitamin B12 in the body. Folic acid deficiency leads to a type of megaloblastic anemia that presents with a blood picture and clinical symptoms similar to those seen in vitamin B12 deficiency, but without central nervous system involvement. This condition is often associated with a poor diet, pregnancy, or the use of chemotherapeutic anti-folic acid drugs such as methotrexate. Unlike vitamin B12, folic acid has low body stores, making deficiency more likely with inadequate intake or increased demand. Non-megaloblastic macrocytic anemias include conditions such as alcoholism, liver disease, and any situations that cause accelerated erythropoiesis. In these types of anemias, the erythrocytes are round, not oval, as is typically seen in megaloblastic anemias. Aplastic anemia. Bone marrow failure causes pancytopenia. Laboratory findings include a decrease in hemoglobin and hematocrit, as well as reticulocytes. This condition presents as normocytic and normochromic anemia, with no response to erythropoietin. Genetic aplastic anemia, also known as Fanconi anemia, is an autosomal recessive trait. It often manifests with dwarfism, renal disease, and mental retardation. There is a strong association with the development of malignancies, especially acute lymphoblastic leukemia. Acquired aplastic anemia, also known as secondary aplastic anemia, can be caused by several factors. Antibiotics such as chloramphenicol and sulfonamides are common culprits. Chemicals like benzene and herbicides can also lead to this condition. About 30% of acquired aplastic anemias are due to drug exposure. Viruses including B19 parvovirus secondary to hepatitis, measles, CMV, and Epstein-Barr virus are also known causes. Additionally, radiation or chemotherapy treatments can result in acquired aplastic anemia. Idiopathic aplastic anemia, also referred to as primary aplastic anemia, accounts for 50 to 70% of aplastic anemia cases. These cases have no known cause, making them particularly challenging to diagnose and treat. Diamond-Blackfan anemia is characterized by true red cell aplasia, where leukocytes and platelets remain normal in number. This condition follows an autosomal inheritance pattern, meaning it is passed down through families. Myelophthisic anemia, also known as marrow replacement anemia, is a type of hypoproliferative anemia. It occurs when bone marrow hematopoietic cells are replaced by malignant cells or fibrotic tissue. This condition is often associated with cancers such as breast, prostate, lung, and melanoma, especially when these cancers metastasize to the bone. Laboratory findings typically show normocytic and normochromic anemia, along with a leukoerythroblastic blood picture.